Okay, next topic, somatoform disorders. Somatoform, soma, body. Somatoform are, these disorders are a collection of disorders where anxiety or psychopathology manifests itself in bodily form. Somehow, something about your actual body is the problem. First disorder, body dysmorphic disorder. This is a very recent classification. I think it was in the last DSM. Most of these disorders were diagnosed from the first DSM on. There's several that have been added. This is one of them. And it's an over-concern with bodily flaws. Facial or body in general. Related to some degree to eating disorders, but it's slightly different as well. And if there was ever a disorder that became classified because of one person, it's this one. Michael Jackson's multiple plastic surgeries and other work that he's had done to himself before he passed on drew the attention of millions of people, and it brought focus to this disorder. It's not as if he's the only one who has it. It's just that he was a very high-profile individual who had it. So people with this disorder have a lot of plastic surgery. And when you don't like the way you look, it's really a reflection of something inside yourself, mentally or emotionally. But like I said, it manifests itself in this way. And it's associated with, first, social phobia. You don't like the way you look, you feel uncomfortable being with other people. And depression. You know, this feeling that you can't overcome this problem that you have. If you don't like the way you look, well, with plastic surgery, I guess you can overcome it, nevertheless. Second disorder, hypochondriasis. You probably never heard of this disorder exactly like this, but you certainly have heard of someone who's a hypochondriac. They have extreme fear of disease. Remember, I gave you a differential diagnosis of hypochondriasis and obsessive compulsive disorder in a previous lecture. Obsessive compulsives know that they're really not, their fear of germs is pathological. Hypochondriacs don't. They really feel that they're going to get ill. And as you might guess, this leads to feelings of anxiety and depression. Okay, that's the one I talked about before. What causes this? What causes people to be so frightened of getting sick? One thought is overprotective mothers. Another one is that someone in their family had a serious illness. I actually have an example. My father, when he got older, came to live with me, and I pretty much took care of him. And one of the things you do when you take care of your parent or parents is you go to the doctor with them. And we went in to see his internist, general practitioner, and I watched him as the doctor came in, said, "Okay, what's bothering you?" And he told him, and this is a doctor he'd known for decades. His doctor then said to him, "What do you think's wrong?" And my father then went about giving him all the reasons he thought he was ill. And I said to him at that point I was already teaching psychology. I said to him, like, in a very surprised way, I said, "You're a classic hypochondriac." And I walked out with him, and I started thinking, my uncle, my father's brother, had contracted polio when he was a kid. So I am sure that my father grew up with a great fear of illness. And look at the other factor. I'm sure my grandmother was very overprotective. Your first child gets this horrible, in case you don't know what polio is, it's like a neurological disorder that leaves people crippled. Kids, usually crippled. Jonas Salk came up with a vaccine for it a long time ago, so we don't have to worry about it. But it was horrendous. So my father had both of these. So I felt this sense of sympathy for my father at that point. Next, somatization disorder. This is differential diagnosis with hypochondriasis. These people are not as specific, and they just say, oh, like my arm hurts or my leg hurts. But they don't really, hypochondriac will tell you, will read up about what the problem probably is. Okay? Begins early in life. People, in other words, people who complain about their body and their health when they're older are so common that it's not even considered a disorder. But before the age of 30, if you're doing this, it's somatization. Okay. The differential diagnosis, vague, they're dramatic, they're trying to get attention with their symptoms, but they don't really believe that they're ill. All right, more about that later. And how do you diagnose this? Well, a person has at least 4 pain, 2 gastro, 1 sexual, neurological. In other words, there's many different criteria for it. You don't have to have all of them, but if you have some of these in this constellation, then you're diagnosed with somatoform disorder. If they don't like what one doctor says, they go to another doctor until they get the one they want. Conversion disorder. Conversion disorder you actually know already. You just don't know it by this name. This is what Freud referred to as hysterical illness. We now call it conversion disorder. And remember, this is Freud thought it was indicative of somebody who had a conflict. And then they repressed it, and it came, their psychological symptoms manifested as physical disorders. Okay? It's not malingering. It's not, oh, achoo, I can't go to work today. It's not that. Remember, these people have like hysterical blindness or hysterical anesthesia, I can't feel my arm, or hysterical paralysis, I can't move my leg. Thing is, on some level though, they know that they're not ill. Because say you walk somebody who, I'm blind, okay, someone hysterically blind, you walk them down the hall, helping them, and then let's say there's a footstool in front of them, they're like, whoop, they walk around the footstool. They don't realize that they're doing this, but at some level they know they're not ill. Alright, and next category is dissociative disorders. And these are disorders of memory. And of course, what's the clearest disorder of memory? Amnesia. I can't remember. Remember, we talked about we already talked about this with HM. He had anterograde amnesia. Everything since the surgery, he's unable to encode into long-term memory, but he can remember everything before the surgery. Then there's retroactive amnesia. Oh, I got hit on the head. I can't remember who I am or anything. That's everything going backward. That's retroactive. Excuse me. Also, both of those are examples of organic amnesia. Something about your body. HM had his hippocampus removed. That was real. Or if you get hit in the head, you have a brain problem, a symptom. Dissociative amnesia is what we call psychogenic amnesia. The beginnings are psychological. So this comes from some stressful event. And then there's dissociative fugue. Dissociative fugue is dissociative amnesia plus the person leaves the place where they are. What does that mean? Okay, it's an unusual disorder. First of all, what is fugue? Well, tempus fugit. Time flies. This is dissociative flying or fleeing from a scene. Fleeing because, let's say it's a battered wife who's been treated horribly for a long time. All of a sudden, she has this psychogenic amnesia. She can't remember who she is, where she's from, and she leaves. She gets out of there. It's very adaptive, and it happens. It's unusual, but it gets the person away from the very difficult situation that they're in. And of course, one more thing. In dissociative fugue, this is one like you see in movies or something, where all of a sudden they look at a book of matches and it said, "Oh my God, I remember. I used to live in Ohio with this guy, and oh, it was horrible." Like years later. And there are documented cases, not a lot. Remember, this is unusual, but there are some cases like that. You also know this one, dissociative identity disorder. It's a new name for multiple personality disorder. Multiple personality disorder. And this is a very controversial diagnosis. There are a lot of people who think it doesn't exist. They think that clinicians elicit this from their patients somehow. There's two types. There's alternating personalities, and there's multiple personalities. So alternating personalities means two personalities. And in the case of alternating personalities, each personality is not aware of the other. So a person would wake up somewhere and go, "How did I get here? What am I doing?" And that would happen frequently. And certain environmental situations would bring out one personality or the other. Multiple personality, there is a primary personality, and then there are subordinate personalities. All of the subordinate personalities are aware of the primary, but the primary is not aware of the subordinates. So at various times, stressful times, the subordinate personalities will come out. Maybe the defensive person. And there's always a child. That's one of the subordinate personalities. There's usually someone of the opposite sex is one of the personalities. Remember, even this extreme example. Remember the point that I started off with. Mental illness or mental disorders are seen on a continuum. Do you act differently with different people? Well, think about that. Is this just an extension of that? So this person, and okay, what is usually the etiology or causation of this? Well, extremely stressful events early in life. So abuse, physical, sexual abuse of a child can, in the worst cases, lead to dissociative identity disorder.